What if your body was trying to warn you quietly, gently, long before a heart attack or stroke ever showed up? The truth is, it does. Your arteries don't shout in the beginning, they whisper, a little ache in the legs when you walk, breath that runs out faster than it used to, fatigue you can't quite explain. A moment where your vision blurs or your words slip, easy to dismiss, but these are not random. They're messages, early signals that something deeper may be happening inside your blood vessels. Most people ignore them. They wait until the whisper becomes a scream. But you don't have to. If you can recognize these hidden signs, you can act in time before it's too late. And that's what we're going to uncover today. Not with fear, but with clarity. Because the power of knowing and then doing something about it can change the entire trajectory of your health. Stay with me because in the next few minutes, you'll learn how to translate those whispers into action, and that knowledge may end up protecting not just your years but the quality of every year ahead. Imagine this with me for a moment. You're out for a walk, maybe with a friend, maybe just to clear your head. At first everything feels fine, but then, almost predictably, a heaviness creeps into your calves. It's not quite a sharp pain, more like a cramp, a pressure, or even just fatigue that makes each step feel like you're dragging around weights. You stop, rest for a minute or two, and suddenly the discomfort fades away. You start walking again, and there it is, right on schedule. That pattern is what physicians call intermittent claudication. And while many people brush it off as just aging, it's often a red flag for something far more serious: clogged arteries in the legs or peripheral artery disease. Here's what's actually happening inside your body. When you walk, your leg muscles act like engines burning fuel and demanding oxygen to meet that demand. Arteries are supposed to dilate, delivering more blood flow. But when cholesterol and inflammatory debris build up in the vessel wall, the arteries stiffen and narrow. Imagine turning a garden hose into a narrow straw. The muscles don't get the oxygen they need. Metabolic waste builds up, and nerve endings signal discomfort. Resting reduces the oxygen demand. The balance resets and the pain disappears until you start walking again. That cycle is a very specific fingerprint of blocked arteries. It's important to know this doesn't always show up as textbook pain. Some people feel weakness, a tightening, or just unusual fatigue, and the location can vary. If the blockage is lower down, you'll feel it in the calves. If it's higher, say in the iliac arteries, you may notice it in the thighs or buttocks. What makes it distinct is its reproducibility. It appears with exertion at a fairly predictable distance, and it eases quickly with rest. That's what separates it from sore joints or muscle strain. Why should you care? Because peripheral artery disease doesn't just affect your legs, it's a systemic condition, meaning the same process that narrows the vessels in your calves may also be affecting your heart and brain. So leg discomfort while walking can actually be your body's early warning siren for heart attack or stroke risk. Now, what can be done? The first step is a very simple non-invasive test called the ankle brachial index. It compares blood pressure in your ankle to that in your arm. A lower ratio suggests reduced blood flow. If confirmed, the treatment plan almost always starts with lifestyle, structured walking programs that gently push through the discomfort and build new collateral vessels, dietary adjustments that improve cholesterol and blood pressure, and of course quitting smoking, which is the single biggest accelerator of this disease. In some cases, medications or procedures are needed, but often the first and most powerful interventions are the daily choices you make. So if you've been blaming your shoes, your age, or just tired legs, but you notice this pattern of exertional pain that resolves with rest, don't ignore it. This could be your arteries whispering before they shout. Sometimes the body speaks in ways we don't expect. When people think about clogged heart arteries, they imagine the classic picture: crushing chest pain, maybe radiating to the arm or jaw. But the reality is that for many individuals, especially older adults, women, and those with diabetes, the warning signs are far more subtle. Instead of chest pain, the heart's struggle for oxygen can show up as shortness of breath, unusual fatigue, or even light-headedness and nausea. These are what doctors call anginal equivalents, and they're every bit as important as chest discomfort, if not more so, because they're so often overlooked. Let's look at what's happening inside. The heart is a muscle, and like every other muscle in the body, it requires oxygen delivered by blood flow. When the coronary arteries are narrowed by plaque, that supply becomes limited, particularly during exertion. The mismatch between what the heart muscle needs and what the vessels can provide is called ischemia. Now, here's the key. Not everyone's nervous system interprets ischemia the same way. Some brains register it as pressure or pain in the chest. Others translate it into shortness of breath, profound tiredness, or even vague discomfort in the shoulders, jaw, or upper back. For people with diabetes, nerve changes can blunt the usual pain signals, so fatigue and breathlessness often stand out as the first signs. This is why it's so important not to ignore changes in your endurance. If you notice that climbing stairs, carrying groceries, or walking uphill leaves you winded in a way that feels new, or if you feel a deep fatigue that seems out of proportion to your effort, that's your body sending a signal. What makes it especially concerning is if these symptoms ease with rest, much like traditional angina would. That pattern provoked by exertion, relieved by rest, is the heart quietly warning you that something isn't right. So what should you do if you notice these signals? The next step is to bring it up with your healthcare provider. They may suggest a stress test, an echocardiogram, or advanced imaging like a coronary CT scan depending on your history and risk factors. The goal is to detect ischemia before it escalates into a heart attack. And while the tests are important, so are the daily habits that support cardiovascular health. Consistent physical activity, eating a Mediterranean-style diet rich in plants and healthy fats, controlling blood pressure and blood sugar, and avoiding smoking all strengthen the vascular system. Shortness of breath and unexplained fatigue aren't just signs of getting older. They can be whispers from your heart. Paying attention to them and acting on them early can make the difference between prevention and crisis. When most people hear the term erectile dysfunction, their first thought is hormones, stress, or maybe even aging. But here's something that often gets missed. Erectile dysfunction can actually be one of the earliest warning signs of clogged arteries. And the reason is simple: blood flow. The arteries that supply the penis are only about 2 to 3 millimeters wide. Compare that to the coronary arteries in the heart, which are larger. So, if plaque is starting to build up in the body's vascular system, it's those smaller vessels that get affected first. That means problems with circulation may show up in the bedroom years before they show up as chest pain or a heart attack. Physiologically, an erection is a vascular event. The lining of those arteries, the endothelium, has to release nitric oxide, which relaxes smooth muscle, allowing blood to rush in and be trapped under pressure. If the endothelium is damaged by things like smoking, diabetes, high cholesterol, or hypertension, nitric oxide production drops. The vessels can't dilate properly, flow is impaired, and suddenly what seems like a private or isolated problem is actually the body's early signal that systemic atherosclerosis may already be underway. This connection has been studied extensively. Men who develop erectile dysfunction are more likely to suffer a cardiovascular event down the road, sometimes within just a few years. It's not that every case of ED is vascular. Psychological stress and hormonal shifts can play a role, but the overlap with cardiovascular disease is so strong that experts now consider erectile dysfunction a vascular red flag. In fact, some cardiologists will ask about sexual function as part of routine cardiovascular risk screening, precisely because it can provide an early clue. So what does this mean in practice? First, if erectile dysfunction is new or worsening, it's important not to dismiss it or just cover it up with medication. It deserves a deeper look at blood pressure, blood sugar, cholesterol, body weight, and lifestyle habits. Sometimes, addressing those root causes not only improves overall vascular health but also improves erectile function itself. Exercise, particularly aerobic activity, can restore endothelial health, losing excess weight reduces insulin resistance. Quitting smoking can dramatically improve nitric oxide availability. These are the same changes that lower risk for heart attack and stroke. The bottom line is this: erectile dysfunction may feel like an uncomfortable subject, but it's really just the body sending a signal. If you listen to it and take action, rather than ignoring it, you may not only improve quality of life, but also prevent the far more serious consequences of vascular disease later on. One of the most dangerous mistakes we can make with our health is to dismiss symptoms just because they go away. This is especially true with what's called a transient ischemic attack, or TIA. Some people refer to it as a mini stroke, but that name can be misleading because there's nothing small about its implications. A TIA happens when blood flow to part of the brain is temporarily blocked, maybe for a few minutes, maybe for an hour, and then restored before permanent damage occurs. The person may experience sudden slurred speech, weakness, or numbness on one side of the body, difficulty seeing out of one eye, or loss of balance. And then, just as quickly, the symptoms vanish. It's easy to shrug it off, but a TIA is one of the clearest and most urgent warning signs that arteries feeding the brain are clogged or unstable. To understand why, let's look at the physiology. The brain is an incredibly demanding organ. It accounts for only about 2% of body weight, but consumes nearly 20% of the body's oxygen supply. Even a brief interruption in blood flow starves neurons of oxygen and glucose. With a TIA, a small clot, often originating from a plaque in the carotid arteries, or sometimes from the heart, temporarily plugs a vessel. When that clot dissolves or moves, circulation resumes and the symptoms resolve. But the same process that caused that transient blockage can just as easily create a larger clot the next time, leading to a full-blown stroke. That's why physicians often say a TIA is not a mini stroke, but rather a warning stroke. The statistics here are sobering. Roughly 1 in 3 people who experience a TIA will go on to have a major stroke, and in many cases that stroke occurs within days. That's why it is critical to treat a TIA as a medical emergency, not something to schedule a checkup for weeks later. The faster evaluation happens through brain imaging, carotid artery ultrasound or CT, heart rhythm monitoring, the faster steps can be taken to prevent a more catastrophic event. Those steps may include medications to thin the blood, lower cholesterol, control blood pressure, or in some cases, surgery or stenting of a narrowed carotid artery. So if you or someone around you experiences sudden weakness, sudden vision loss, sudden trouble speaking, or loss of coordination, even if it lasts only a few minutes, the safest move is to call emergency services right away. Your body may be whispering for now, but it's telling you that the next event may not be so forgiving. Listening in that moment can save a life. Sometimes the signs of clogged arteries aren't hidden deep inside the chest or brain. They're right in front of us on the surface of the skin. Cold feet, weak pulses in the ankles, sores that take far too long to heal, or even subtle changes like shiny skin, brittle toenails, or loss of hair on the legs. These are outward reflections of what's happening inside the blood vessels. They point to a condition called peripheral artery disease, or PAD-DA, where plaque narrows the arteries that carry oxygen-rich blood to the legs and feet. Think about what circulation does. Every heartbeat sends a surge of blood carrying oxygen and nutrients to tissues that are constantly repairing, growing, and fighting off infection. When arteries are narrowed, that supply line is compromised. The skin may become thin and fragile because it isn't receiving what it needs. Wounds, even something as small as a blister or scrape, may linger because the cells can't get enough fuel to knit new tissue. Feet and toes may feel cooler than the rest of the body because warm, oxygenated blood isn't reaching them efficiently. And if you feel for a pulse on the top of the foot or behind the ankle, and it's faint compared to the wrist, that's a clue that flow is diminished. These changes aren't just cosmetic inconveniences, they are signals of real risk. PAD is strongly linked to heart attacks and strokes because it reflects systemic atherosclerosis. The same process narrowing the vessels in the legs is usually at work in the coronary arteries and the carotids. So a non-healing sore on the toe isn't only about limb health, it's about overall vascular health. And in advanced cases, if flow is severely limited, tissue can die, leading to serious infections and in some cases amputation. The encouraging news is that PAD can be detected and addressed before it reaches that stage. A simple test called the ankle brachial index compares blood pressure in the ankle to that in the arm. If the ankle pressure is significantly lower, it's a sign of blocked flow. From there, doctors may use ultrasound or imaging to pinpoint the problem. The first steps in treatment almost always focus on lifestyle, stopping smoking if you smoke, controlling blood pressure, cholesterol, and blood sugar, and engaging in a structured walking program that pushes the muscles to adapt and helps the body form natural bypass vessels. In some cases, procedures to open or bypass blocked arteries may be necessary. So when your skin, nails, or wounds seem off, don't just cover them with a bandage and forget about it. They may be your body's way of pointing you to something much bigger, a reminder that the health of your arteries is the foundation of the health of your entire body. When we've talked about clogged arteries, it can sound frightening: heart attacks, strokes, amputations. But here's the encouraging truth. There's a lot you can do right now to shift the trajectory, no matter where you're starting from. And it begins with knowing your numbers. Blood pressure, fasting, glucose or hemoglobin A, 1C, and a lipid panel are like the dashboard gauges in your car. They don't tell the whole story, but they give you a clear sense of how stressed the system is. If you've noticed symptoms in your legs, a simple ankle brachial index can be done in the clinic. It's just blood pressure cuffs on the arm and ankle comparing the two readings. That test alone can uncover peripheral artery disease early. And if you've had episodes of chest discomfort, unexplained fatigue, or what could have been a mini stroke, then timely evaluation, whether a stress test, an echocardiogram, or brain imaging, isn't optional. It's essential. But testing is only the first step. The daily inputs you give your body matter just as much. Exercise remains one of the most powerful tools we have. For people with peripheral artery disease, walking to the point of mild discomfort, resting, and then repeating can stimulate the growth of collateral blood vessels, your body's natural bypass system. For heart health, 150 minutes of moderate aerobic activity each week, combined with 2 or 3 days of resistance training, significantly improves endothelial function and lowers risk. Movement is medicine, and it's one of the most reliable prescriptions you can write for yourself. Diet is another lever you can pull every single day. The evidence consistently points toward a Mediterranean-style pattern: vegetables, fruits, legumes, whole grains, fish, nuts, and olive oil as the foundation. It's not about restriction, it's about fueling your body in a way that reduces inflammation, supports healthy cholesterol levels, and stabilizes blood sugar. These shifts don't need to be radical overnight. Even small, consistent changes compound over time. There are also the quiet but equally powerful factors: sleep and stress. Poor sleep raises blood pressure, worsens insulin resistance, and increases inflammation. Chronic stress drives the same pathways. By making space for 7 to 8 hours of restorative sleep and practicing stress reduction strategies, deep breathing, prayer, meditation, or time in nature, you're giving your arteries a break from constant pressure. Finally, medications may be part of the plan, and that's not a failure. Statins, blood pressure drugs, or antiplatelet therapy can be life-saving tools when used appropriately. The key is combining them with lifestyle, so the effect is multiplied. So what do you do now? Get your numbers checked, pay attention to the signals your body is giving. Move more, eat smarter, rest well, and partner with your clinician on the right strategy. This isn't about perfection, it's about direction. Every step you take today is a step toward keeping those arteries open tomorrow. Your arteries are not your fate, they're a living system that responds to your daily choices. The 5 signs we covered are not there to scare you, they're there to serve you, to pull the fire alarm before the fire spreads. Breathe a little deeper. walk a little farther, eat a little smarter, ask one braver question at your next checkup. Because the most powerful moment to prevent a heart attack or stroke isn't in the ambulance, it's now, while your body is still whispering. Listen once, act twice, and let today be the day you redirect the story your arteries are telling.